Who is benefiting the most from us being here? Is it the medical brigade or the local population? Hello friends, welcome back to the channel. Today we're going to be talking about some basic public health phrasing, principles, and the healthcare in Ecuador. The reason for this is that that's where I'm going to be going for my school spring break for 2023. So to start, we want to make sure that we all understand each other and are using language that is recognizable from organization to organization, especially when referring to countries and populations. First, we need to address the old terminology of first, second, and third world countries. These terms were coined by a French demographer named Alfred Sauvé during the Cold War. He deemed first world countries to be those associated with the ideologies of NATO and capitalist countries. Second world countries were those aligned with the USSR and communism. And finally, third world countries were literally everyone else. This old nomenclature, due to third world, included countries such as Saudi Arabia and Malawi. They include drastically different living conditions and gross national incomes. It's an outdated classification of countries, and most people don't use it anymore. However, the UN and the WHO now use the terms developed, developing, and least developed countries, or LDCs. The making of the LDC list considers many factors, including healthcare, education, economic growth, among other things. This designation of LDC gives these countries preferential treatment regarding trade, international aid, and infrastructure building opportunities, which are really important to get these countries back kind of up and running. The International Monetary Fund, the IMF, and the World Bank uses terms based on objective data such as gross national income and population-based metrics such as the number of schools per capita, years of education, and unemployment statistics. They group countries into high, middle-low, and low-income countries. Many low and middle-income countries, or LMICs, are given preferential investment opportunities and special loan terms and agreements to help with infrastructure building, education, healthcare, and economic development. The most common metric which countries are measured by now involve financial and human development, rather than political affiliation or economic theory. Therefore, most public health professionals now use the terms developed, developing, or least developed countries, or the high-income, middle-income, and low-income countries. Using these monikers allows donor countries and organizations such as the UN and the WHO to align financial help with countries where the return on investment has the highest impact. This is also important because it is given to countries that are preferentially willing to implement public health programs. Public health often regards their initiatives in three different categories: primary, secondary, and tertiary prevention. Primary prevention is based upon complete prevention or elimination of dangers or diseases. For example, pediatric DTaP vaccination campaigns. Secondary prevention is used for screening and early treatment of healthcare issues before they show clinical manifestations. This can include things like STI screening, treatment, and reporting to contain any infections before they become epidemics. Tertiary prevention occurs when someone has a chronic disease or is presenting with clinical significance requiring more extensive treatment and rehabilitation. This can include a child with tetanus, presenting with lockjaw, or diphtheria, causing myocarditis and lifelong nerve damage. This is the form of prevention and mindset that most physicians practice. So, given these three prevention classifications, you can see they also scale in terms of severity and cost associated with treatment. Our example of the DTaP vaccinations, for instance, costs $28.02 for a single vaccination per the CDC. The full course of 5 vaccinations during childhood would equate to $140 per child. However, the CDC also reports that a child acquiring tetanus has a 100% hospitalization rate with a total cost in 2013 of $102,584. That's a 733% increase, which is ridiculous. So, now that we understand the differences in primary, secondary, and tertiary prevention, let's talk about healthcare in Ecuador. Nutritionally, 26% of children under 5 years old suffer from chronic malnourishment. This directly relates to Ecuador having a poverty rate of 10%. That means that 10% of the country lives on less than $3.20 per person per day. This makes sense then why almost 9% of the country lives without soap and clean water available in the home or any form of hand washing stations. Without hand washing, it's easy to see why diseases like typhoid and hepatitis A are some of the leading communicable diseases in Ecuador. Without hand washing, it is very easy to spread disease via the fecal oral route. Now, Ecuador does have a universal healthcare scheme that the majority of the country benefits from and pays into. However, the monthly cost is $70 and still includes a general practitioner copay of $25 per visit, and seeing a specialist costs around $35 per visit. With costs like these, it's easy to see why healthcare is hard to access for the poor and why they remain underserved. With these barriers to care, the medical brigades, such as the one my school is participating in, are very important, but they are not a lasting or permanent fix. It's important for schools and medical brigades going to LMICs for short periods of time to ask the question, who is benefiting the most from us being here? Is it the medical brigade or the local population? Who has the power in the relationship and decision making regarding program development and resources? Is it the local population or the incoming aid workers? Finally, tertiary prevention is an important part of any public health program. However, it should only be the starting place, with the main goal of increased capacity building and initiation of primary and secondary prevention models to the point where tertiary care isn't needed from an outside agency. Remember, as the saying goes, an ounce of prevention is worth a pound of cure. All right, until next time, reflect on yourself, your community, and how you are capable of making the changes you want to see in the world.